Hello, this chapter section is about pain and its management, and this is a quote by a Canadian songwriter and singer, Sarah McLachlan. So all of us have experienced pain and may have felt like the quote above, hold on to yourself, for this is going to hurt like hell. Here's just a little stock photo of the experience of pain and some of the medications that are used to treat pain. All right, pain and its treatment models include single service clinics that treat all diseases and not just pain. Pain clinics that try to treat pain symptoms and to alleviate pain. Multidisciplinary pain clinics and pain centers. And the last one would be most all-inclusive. So here's the definition of pain. We've all experienced it. It's actually probably hard to define, but this is as good a definition as any. Hurting or strong discomfort in some part of the body caused by injury, disease, or disorder, and it is transmitted through the nervous system. So we'll talk more about this as we go through this PowerPoint. There are different general types of pain: acute pain, which is severe but does not last long; chronic pain, which continues; nociceptive pain, which is caused by burns or other injuries; and neuropathic pain, of course, which involves some disorder of the nervous system. So we will discuss and look at each of these individually. Here's acute pain. And as I mentioned, it begins suddenly and is usually very sharp in quality. And here are some of the events that might cause it: surgery, broken bones, dental work, burns or cuts, labor and childbirth. It could be mild, or it might be severe and last for weeks or months. In most cases, acute pain does not last longer than 6 months, and it does disappear when the underlying cause has been treated or has healed. But if the acute pain is unrelieved, it might lead to chronic pain. So chronic pain persists despite the fact that the injury has healed, and the pain signals can remain active in the nervous system for weeks, months, or even years. The physical effects include tense muscles, limited mobility, lack of energy, and changes in appetite, so very far-reaching. There are many emotional effects, including depression, anger, and fear of re-injury, and this could definitely affect a person's lifestyle and the ability to return to normal work or normal play. Very debilitating. It could include some of the following: headache, low back pain, cancer pain, arthritis pain, neurogenic pain, which is the result of damage to nerves, psychogenic pain, which is a pain not due to past disease or injury or any visible sign of damage, but it is very real pain. And chronic pain may have originated from an initial trauma or infection. Some people suffer chronic pain in the absence of any such past injury or evidence of body damage. So what is the difference? There might be no known cure for the disease, such as arthritis or phantom pain, that is causing chronic pain. Usually acute pain can be treated and cured. The cause of chronic pain may not really ever be understood. Here's a link to an article that defines and looks at those two types of pain, and I think it will give you a pretty good idea about some of the ways to manage pain. So please make sure you take a look at it and get a general idea of the differences between nociceptive and neuropathic pain. And this will be an introduction to the topics coming up. Nociceptive pain is caused when special nerve endings called the nociceptors are irritated. And as I mentioned earlier, it's the type of pain you or another person might feel when they burn themselves, twist an ankle, or stub a toe. It's dull or sharp, and its aching can be mild to severe. This type of pain usually can be controlled, and it's usually temporary. Cancer pain and arthritis pain are common types of chronic nociceptive pain, so it can become a chronic condition. It usually responds well to pain medications or anti-inflammatory agents or some other drug or even alternative therapies. It usually does not respond well to neurostimulation. Neuropathic pain is caused, as I mentioned a couple slides ago, by a malfunction of the nervous system due to an injury or an illness. It could be sharp, intense, or shooting pain. It's very stubborn and doesn't usually respond as well as nociceptive pain. And unlike nociceptive pain, it can often be managed by neurostimulation. So there is some therapy for this type of pain. Other types of pain include angina, which is indicative of heart disease. And go to this website and take a look at some definition and a little bit of information about angina. And again, when you go to a website, highlight the link and then right-click and choose Open Hyperlink. Another type of pain is breakthrough pain, which is often a part of, say, pain treatment, palliative care, or cancer care. It's defined as pain that occurs between the regularly scheduled doses of pain medication. It's often abbreviated as BTP. And most patients with chronic pain, including palliative care and hospice patients, are given medication as needed. And these medications are usually fast acting and have a short duration. The common medication used is oral morphine for this type of pain. Malignant pain is caused by cancer and its treatment. Phantom limb pain, I have here a highlight for a YouTube that describes phantom pain. So as you look at this, look at some of the causes of phantom pain and why it is difficult to treat. Psychogenic pain, as I mentioned, is real pain, but it is without a known physical cause. Some of the variables of pain include whether a person has experienced pain early in life, the cultural background, anxiety and depression, age, or gender, and all of these variables can affect a person's experience or expression of their experience of pain. The gate control theory of pain says that pain is a balance of information traveling between large and small nerve fibers. And if you don't stimulate certain nerve fibers, you won't feel the pain, or the pain won't be transmitted. Here is a link to a little animated YouTube that is quite good in explaining and defining the gate control theory of pain. So please go there and take a look. And here's another link to some pain assessment information that you can use for reference. I don't expect you to learn all of that, but I think this is a good reference for you for now and for the future. To assess pain, we need to know the amount of pain, I went in the wrong order, the place of the pain, where it is occurring, the amount of pain, the interactions, whether other things are going on in the person's life, the person's body, and what we can do to neutralize the pain. And there are many different treatments for pain. It depends upon its severity, and it could be over-the-counter drugs, it could be narcotics, it could be localized anesthetics, nerve blockage, acupuncture, electrical stimulation, physical therapy, surgery, psychotherapy, and that's really good to help alleviate some of the depression that might go along with the experiences, especially of chronic pain, relaxation techniques, biofeedback, behavior modification, and notice some of these are considered complementary or alternative therapies. Here are some treatments. Medications are described, non-prescription, prescription, a patient-controlled analgesia pump, an intrathecal drug therapy, surgery, placebos often work. And here are some complementary therapies used in pain management. biofeedback, relaxation, imagery, hypnosis, TENS, which involves neural stimulation, electrical stimulation, massage, additional complementary therapies, humor, laughter, and play, music, acupuncture, aromatherapy, therapeutic touch, and Reiki and yoga. Here is a description or a little illustration of acupuncture treatment. And then here I'm ending with a reference, a webinar by a physician at Sloan Kettering Cancer Center, which is in New York. So this is a very, say, traditional, established place for treatments of cancer. And I like this resource because the physician not only describes how complementary therapy can be used in pain treatment, pain management, but also talks about some precautions and also gives a good definition of some of the complementary medicine and what it means. So please go to this resource. Again, contact me if you have any questions and or comments about this or anything else having to do with the class. All right, this is the end of this narrated PowerPoint.